with our fourth community planning process for our Mental Health Services Act annual update. I'll be sharing a PowerPoint shortly that we'll be going through. We'll spend about 20 minutes of this session kind of doing the presentation and then opening up the remainder of the session for any questions, comments, or input. I'm Ahmad Brahmi. I'm one of the division managers here at the Fresno County Department of Behavioral Health. And my team is spearheading the MHSA annual update. So this session is going to be recorded, as have the other. The recording is really so that we can make sure we capture any questions, comments, things of that sort that we can go back through later and make sure that we're able to transcribe that. And with that said, I'm going to try to share my screen and hopefully get the right PowerPoint up and that it'll play, and we'll dive right into that. There we go. So as we mentioned, this is our community planning process. This is our second one of today. As we did have one earlier this morning in Hmong. We had one on last Friday in Spanish. And I believe at the beginning of the week, last week, we did our first English one. These sessions are live, but we are also having them live streamed through YouTube. And I believe this one is going to work on Facebook. We did have some issues with Facebook earlier and yesterday, so there were some things we were not able to get on there. However, the content for this morning, the YouTube link will be posted onto Facebook as well, so people can go back and watch those. This is not our community's only chance for input. There'll be opportunities for input over the next several weeks. We'll provide some information as well as emails where you can continue to send questions, comments, things of that sort. But I'll go through the process here shortly. So we're going to kick it off with just discussing who the Department of Behavioral Health is, if anyone is new. If you've been through our presentation last Monday, this is going to be almost the same. We're going to do everything we can to keep it as close as possible, but it may not be verbatim. And so if you went through our community plan process as part of our 3-year plan, a lot of the slides may look familiar to you. So the Behavioral Health Department is a county department of Fresno County. We provide our overseas services for individuals that may have a moderate to severe mental health challenge. We either provide or fund substance use disorder services, which are inpatient, outpatient, different levels, as well as conducting prevention, education, and training that are related to the field of behavioral health. In addition, the department does fund and or oversee or provide over 100 programs countywide. We have 70 different contractors that make up our system of care, so it is a robust system. And we work with our partners in terms of making sure that we're able to meet our broad community needs. The services that our system of care provides is for individuals that are primarily Medi-Cal eligible or underinsured. That is for more of our direct services. When we talk about things like prevention, when we talk about things like education and training, those are obviously not limited to individuals with insurance, because it's not necessarily like a direct service, as they are more the prevention services or the types of services that are being rendered are not things that currently a managed care provider or an insurance or someone else would do. So our prevention activities and services are geared towards all of Fresno County. But when it comes to some of our behavioral health services, those may have some specific eligibility criteria. And then our services basically go from 0 to end of life. So that's children, teens, transition age youth, young adults, and older adults. Like I said, the entire continuum of life or spectrum of life. So now we're going to dive into what is the Mental Health Services Act, also known as MHSA. Mental Health Services Act was a proposition passed in 2004 by voters. It was a ballot initiative. At the time, it was Prop 63. You'll see the logo on there. However, the state does have only so many numbers. They do not have, well, I guess mathematically, they have an infinite number of access to numbers, but the state primarily does use a handful of numbers, I think like 1 through like 200, for propositions and ballot initiatives. And so in time, the Prop 63 number is utilized in other initiatives in the future. So that's where we've kind of gone away from really calling a Prop 63 and really utilizing the term the Mental Health Services Act, because it's something that is now in law, is codified. That's not going to change. It is a Mental Health Service Act is a 1% tax on annual incomes over $1 million. So what that means is if last year someone made $900,000, they're not going to be taxed that 1%. This year I got lucky and I made $1 million. I'm going to get taxed 1% on that $1 million. But if next year I make $998,000, I will not be taxed at 1%. Now, most of us in California are not millionaires, so we're not paying that extra 1% tax, but annual incomes for over $1 million are taxed for the purposes of the Mental Health Service Act. And also because it is a tax-driven um, funding source, it is volatile. So, if we're facing an economic downturn or recession, that can impact future funds. If a lot of millionaires are leaving the state, that could impact. So and because it is an annual income, not permanent. So somebody may have had a really productive year in whatever business or work they're doing, and they hit $1 million, but next year they don't. They will not be taxed on next year. So it's kind of a little bit of inconsistent too in there. The funds that are generated through the Mental Health Service Act 1% tax are 3 years out. So the money that people are taxed this year would not come to counties till 3 years from now. So it does give us some lag time and some time to plan. But that's one of the things that we do have to consider with Mental Health Service Act, that it is, because it's tax driven, can be volatile. Um, Mental Health Services Act does focus on community-based mental health services. So what that means is the services are supposed to be provided in a community setting, as close to a person's supports and their regular living conditions. So Mental Health Services Act is prohibited from being able to provide services in hospitals, in institutions, in correctional facilities, things of that sort. Mental Health Services Act are required to be developed through community input and looking at needs, which is why we have the annual 3 year plans, why we have the annual updates, why for each one of those there's always the community planning meetings such as these, or we have the 30-day public comments, public hearings, things of that sort, to ensure that there's transparency, but also opportunity for the community to provide input in the work. And then last, Mental Health Services Act was intended to be transformational. It was meant to transform the mental health system in California. California is the only state that has anything like MHSA. So most other states do not have something like Mental Health Service Act, a way to close gaps and really be able to do some of those innovative things, whether they be through innovation and prevention and some of the other activities and programs that Mental Health Service Act currently provides in California and to the different counties. So there are 5 components to the Mental Health Services Act. Oh, 5, not 10. And those are, as you see on the screen, prevention and early intervention, uh, community supports and services, innovation, workforce education, training, capital, facilities, and technology. And I'll go through each of them real quickly. So the first one, prevention and early intervention, those are not two things. That category has 6 different strategies, and they range from prevention, um, suicide prevention, stigma reduction, outreach for early recognition of mental illness, access and linkage, and finally, early intervention. And early intervention, under prevention, early intervention is actually looking at the onset of a severe mental health challenge or diagnosis, and so it does require an actual diagnosis. So early intervention and prevention are not lumped together. They're actually 2 separate things when you get into the deep into the weeds of the PEI. PEI has been utilized to also address a lot of our gaps in terms of um, education, outreach, stigma reduction, but as well as being able to afford us more opportunities to provide culturally responsive, um, culturally informed, culturally specific services. Community supports and services, our CSS, that has 3 components. That's outreach and engagement, which again is outreach and engagement for into individuals that have a serious mental illness. So it's different than our early intervention and some of our prevention work. That's really how do we get people that have um, a diagnosis that's severe, that are maybe not in care, or they're underserved, and being able to get them connected to services or the right level of services. There's the community supports, which is systems development, which is more of our outpatient. A lot of our different support services within MHSA are found in that component. And then last is the full service partnerships, which is our high intensity portions of the Mental Health Service Act. Um, innovation is 5% of our total budget. It does carve out some money from early intervention. It also carves out some money from the community supports and services to do that. Innovation is really meant to be short-term, one-time funding to allow for research, to allow for innovation, learning pilots. But the focus is really on learning. And traditionally, counties had utilized these to start new programs and or seed money. We really in Fresno try to avoid doing that because the innovation projects and funding are one time. If you have a program, for example, that costs $3 million, and so it's $1 million a year, and you fund it for 3 years with innovation, and then at the end of the 3 years, when this funding sunsets, and it's a program that you find is really impactful, that you really want to continue, the challenge now is you have to find a way to fund a program at $1 million. So it's really, for us, makes more sense in Fresno to utilize that innovation to help inform and help us learn and pilot and test out projects versus using them as startup monies. Um, with PEI, going back to PEI does have a requirement that at least just over half, so 50 plus one, so 51% or more of the funding goes towards children and youth. And in Fresno County, we have successfully achieved that benchmark every year. We actually surpass it, and probably I would say I can't remember off the top of my head, but it is a much higher number than that 51% in Fresno of our PEI that goes to children. I do want to touch on innovation real quick. We do have, if you go to our website, FresnoMHSA.com, we do have 4 annual updates for 4 innovation programs. We do have 9 approved. There's 4 that have been active for more than a year. So the annual updates are just reporting on where those programs or those projects are thus far. And so you can go view those as well if you wanted to just kind of familiarize yourself or learn what's going on with those. I do want to know, because those are set up in a specific plan, most of them are part of evaluations or learning projects. They're really not subject to changing through or adapting them. It's kind of set for the 3 years or 5 years, whatever you do, in order to really try to track and trace that particular project. So those ones, that's why we're bringing them to your attention to review, but we're not going through them individually because there's really not much we can change on those. What are some other updates? So for CFTN, it does have a really narrow focus. So capital facilities and technology can be utilized to purchase, build, and make certain improvements. But they do have some requirements with those, as far as they have to be county-owned properties. They cannot be used on housing programs. They have to be basically permanent type of improvements. If you're doing something on a lease property, you have to have a 20-plus year lease. So there's a lot of things that go into how CFTN is utilized. And right now, we're not really having a lot of changes to that. The technology component in our previous plans, we've had investments in terms of upgrading and updating our electronic health records. So that'll continue, but there's really not a lot of changes yet. I'm trying to see if there's anything else we need to focus on. One of the last things with WET, workforce education training, initially when it came out, had its own funding source for 10 years. And then after the 10-year period, it became the responsibility of counties to set money aside or carve money out of their other programs if they were going to do WET, workforce education and training. We do have money invested in WET as part of a statewide effort, and we're part of a central region initiative with multiple counties that were able to get the opportunity to put up some of their funds and receive a match for those. So in Fresno County's case, we put up a little over $300,000, and we were able to get a total of $900,000 to utilize for workforce education training. So that can be anything from career pathways, tuition reimbursement, scholarships, and now there's a statewide work and movement to see if the WET can also be utilized to help with some retention strategies, both in the public behavioral system, which means within the county, but also our contractors that are part of the public system. And with that, I'm going to go ahead and jump into the next slide. What is an MHSA plan? As we mentioned, it's created every 3 years. In between years, we do have what we call our annual updates like this. The annual updates are really more to report on briefly what has happened in the past year, but also if there's going to be any changes and or plans for the coming year. They do serve as a blueprint in terms of how we're utilizing MHSA in our system of care. Once a plan has been approved, our annual update has been approved, if we're making changes to those are things that we do need to come back and discuss in the community to make sure that, again, transparency and community input. So those are things like sometimes we'll have innovation plans that are developed throughout the year. So we can't wait for that 3 year. We need to move the projects along. So we'll have specific community planning sessions or hearings around those. And, if we can, and hopefully in a post-COVID world, our plan is to have input sessions like this throughout the year so that we're not having to come to the community just once a year, but throughout the year, we're getting input that'll help inform our 3 year planning or annual updates. Um, I'm going to go ahead and jump to let me see if there's anything else in that one. Oh, yeah, and I mean, we talk about the 3 year after this annual update. Next year, we're gonna be working on our new MHSA 3 year plan. So if you remember, it was just less than 2 years ago, we were working on the MHSA plan that took place last year. Now we're in year 2. Next year will be year 3, which means we'll start planning for the next year. And so in the 3 year plan is probably where you'll see us do more changes or expansions or things like that. But in the annual updates, we pretty much try to keep it fairly consistent. Um, the contracts and the amounts in our MHSA plan, if you go back and look, those are estimates. They're based on estimates of MHSA, based on estimates of the Medi-Cal billing. So they are not exact, so we do want to call that out. And then also some things that we're going to be coming up here and we're going to discuss in this moment is that we have received some funding, one-time funding from Cal FHA and SNAP, which I believe are our interest accruals that the state is sending back to the county that have to be used for housing. It has to be spent by June 30th, and it's a total of $206,000. So it's not a lot to really fund programs, but it could look at doing some specific gaps in our service. And so some of our community partners have already emailed us some information, some potential ideas around those. So we'll hopefully bring those back to you guys here in a few weeks. Um, in the past, our wet plan was way over and it was subject to reversion. And so for a couple of years, Fresno really worked to try to spend down the wet dollars and make sure that we did not have money go to reversion. So that had to do pre-COVID, had to do a lot of training, a lot of staff development, a lot of opportunities for things like Relias licenses, things like that. However, when we went back and looked in an effort to spend those funds down, there was a year or I think maybe 2 where there was some overspending. And so from what we've had in the plan projected to what we'll have now, we'll make some corrections and modify those so that we can account for the overspending. But also some of the thing that has happened differently in the past year is our staff development department has really created an overall plan of what is our training goals, contracts, I mean, not contracts, but conferences, things like that for the year. So it really can be managed, budgeted, and make sure that we're making the most of those funds and opportunities. Um, Trying to see if there's anything else we have in there for right now. I'm going to go to the next slide. So what is DBH planning to continue doing this coming year? So in the past 2 years and last year, we're continuing to now as we've right-sized some programs. We're continuing to explore and look at every single MHSA program where we almost finished up with all the PEI. Now we're diving into some of the other programs. And the programs we're looking at under MHSA include county operated programs. So we're looking at are our programs, the right size? Do we have programs that are maybe funded at a higher level than they maybe need to be? Do we have programs that need to be adjusted? Do we have programs that have opportunity to utilize or leverage other funding or improve on their maybe Medi-Cal billing so that it can offset the costs? We're also looking at, do we have programs that can be funded through other sources? So is there a program that makes better sense to be funded through some other funding than MHSA, as MHSA is intended to be the funding of last resort? We're also looking at in the coming year, what are going to be potential changes that could happen with payment reform and CalAIM, and could some other services be covered under CalAIM, and thus allowing us to free up maybe some dollars from programs and apply it either in ways of getting our costs down or being able to support or expand other programs or services in our system of care. So we are looking at, and I'm going to define this here in a second. deleting at least 3 programs. When I say delete, these are programs that have appeared in our previous MHSA 3-year plan and our current MHSA 3-year plan, but are not active programs. So they're programs that exist on paper, almost like placeholders at this point, but have not come to fruition, partially in that the funding has not been there, or the funding we need to set up a new program and sustain it over time has not been there. So we've waited. There are programs that when they went through program development and maybe some RFP process, we found to be costing way more than what was available at the time. And some of them are programs that were just not utilized, over time. And so based on those factors, we're looking at deleting 3 programs. When we delete these programs, I want to be clear, nobody's losing funding. Nobody's going to be losing any kind of jobs, and nobody's going to be receiving less services as a result. What we are looking at is how we can leverage some of our existing programs and services to address the needs that those programs would have set up. And again, these were programs that were looked at and were initially thought of about 5, 6 years ago. It was a different landscape. We also had a lot more money at that point that we were needing to spend down, which we were doing. But as we spent that money down in terms of putting up new programs, expanding programs, then it became a question of, if we added some of these other programs, will we be able to sustain them effectively over time? And so that's one of the key things we look at, is sustainability over time. We don't want to start a program and then 3 years later have to stop. So the 3 programs that are going to be deleted is the Adult ACT team, which is assertive community treatment. We're looking at how we can utilize some other services, either through our FSPs, and potentially some other programs that could address the need for that level of care. We're looking at deleting our project, which was an entire continuum to assist individuals affected by human trafficking. So the entire continuum would have gone from the prevention or early outreach and engagement all the way to the high intensity full service partnerships. And looking at a number of varieties, changing the landscape, looking at other resources, looking at existing programs and services, as well as cost. We're going to try to support individuals who fall into would have been served by that continuum of care in some of our existing programs and services. And the last one is wellness activities. Um, those were funds to be able to provide some support services within some of the DBH programs, DBH operated programs, county operated programs that over the past couple of years have just not been utilized. And so making the decision that if the funds have not been utilized over the past couple of years, then there may not have been a need to utilize those particular funds. We've been able to address that need through other funding. And so we're looking at deleting that again, which will allow either to reduce some of our costs or free up some money to be able to support potentially other projects and services. I did talk about sustainability. I do want to note in the past, as of last year, May of last year, Fresno County Department of Behavioral Health has 9 innovation programs approved. 3 years ago, we had none. So in the past couple of years, we've had 9 plans approved. We have 4 that have annual updates on our website, FresnoMHSA.com, that you can go review. There's a total of 7 active innovation plans right now. There'll be an 8th one, which is our California Reducing Disparities Project Evolutions. That'll be set to come online in the next month. And we have 1 remaining innovation plan, the Project Ridewell, that we've not brought online yet. And that has largely to do with COVID, because it was a project looking at testing some transportation resources and services. And with COVID and closed spaces, safety concerns have limited us from launching that one at this time, but we hope to do that soon. And then we have a justice related innovation program that we've had in the plan, and it's in our current plan and previous plans that we're working to hopefully take to the OAC this year. So before the end of this year, we will have a total of 10 approved innovation plans, and only 1 that will be completing or finishing up at the end of this year. So by next fiscal year, we'll still have 9 innovation plans. And so we're also looking with things like that, our capacity, and making sure that we're able to fully support, monitor, evaluate, and learn from those innovation programs so that we can utilize those to inform future decisions, programming, and needs of our system of care. Last thing I want to do is to, and we've shared before, is Fresno County has opted into what would they call AOT, Laura's Law, otherwise known as Adult assisted outpatient treatment for adults. Fresno County has opted in. They are working on that plan. The AOT part, which is the coordination and those things, will be a new component, but they're not MHSA funded. What we will do for the treatment component of AOT is looking to leverage our existing full service partnerships and those programs that provide those wraparound services to support those. So the AOT part will not be a MHSA funded program per se, but it will then utilize existing programs, including MHSA programs, to get individuals the care that they need. So, and as I had mentioned in our previous community planning session about a week ago, I'm not the expert on AOTs, so I can't speak to those, but I know our director, Dewan, did share some updates related to AOT at last Wednesday's Behavioral Health Board meeting. And so there's some information on that out there. All right. The changes that we're planning, as I mentioned, is utilizing our FSPs to support some of the AOT work with our capital facilities and technology, or CFTN. We're looking at investing or continuing what we've already had in there. So it's not a change of utilizing some of the technology to develop the electronic health record that will allow us to better align with new state payment reforms, and being able to, instead of have 20 different systems, that we can really narrow down to one that can interact better with some of the new state systems that are coming on board. But that's something that's already existing in the plans. They're not new. It's the things that will be new is as we continue our evaluation process of all programs, we may look at then making recommendations on programs that may need to be right sized, adjusting budgets, really looking at sustainability. Like I said, there are some of those annual updates for our innovation plans out there, and we do have one new innovation plan that we hope to get out here soon, which will focus on justice involved individuals. And that one, we will have a series of community planning sessions around that and public hearings before we move forward with proposing a formal plan to the state on that one. So be on the lookout for those. And with what, as I mentioned, we are part of a regional workforce development process. Fresno has really looked closely at career pathways that will allow us to diversify our workforce. We're looking at stipends, loan repayments, scholarships, and now statewide, everyone is looking at possibilities of utilizing some of those funds and opportunities and strategies also for retention, as both in the county as well as with a number of our contractors around the state have had challenges with keeping clinicians, psychiatrists, things of that sort in there. So there are some regional strategies looking at that. Fresno does plan to shift or pay into the pot its $300,000 in this coming year, which will then allow us to get that $300,000 back plus an additional $600,000 for about $900,000 to utilize for wet activities. So those are things that we're looking at. This is going to be the part where we're going to turn it over to the public. This is where we're looking at really if there's questions with regard to the MHSA 3-year plan, if there's questions with regard to our annual update, if there's things people identify as needs, or if there's things that people would like for us to consider, or comments, that you'll be able to share it. You'll be able to, we'll unmute, so you'll be able to ask your question if you're on WebEx. If you are on YouTube or on Facebook, just go ahead and enter your questions in the chat. If we do not get to them today, we'll be monitoring the chat on those for the next 5 days. We'll provide a response, but we'll also take all of the questions and utilize those as we work to develop our annual update. So, well, we're going to go ahead and open it up first before we kind of give you guys some next steps. If you want more information, you want more context, maybe you're new to the MHSA planning process, we strongly encourage you to go to our website, which is FresnoMHSA.com. That page is actually on the county DBH page. The URL just makes it easy. Instead of you having to go through co.fresnocounty / all that stuff, just type Fresno MHSA. It'll take you to that page on our website. And we do have a video about what the MHSA community planning process is, as well as 5 short 1-minute videos that kind of break down more details in each component, as well as being able to find copy of the actual plan, annual updates, things of that sort. So if you have any questions, comments, we will utilize this time to answer those. And then if not, if we don't have a lot of questions or comments here in the next few minutes, we'll go over what are some of the next steps, and we'll be able to wrap this up. Aaron's telling me in the chat that there are no chat or questions or comments in the chat yet. So if anyone wants to comment, again, if you're watching this through the WebEx, you can unmute yourself and be able to ask a question. Otherwise, I'm going to go to the next slide just so that people have that info. So I'm also putting on the screen for right now that PowerPoint ways that you can get more info, what happened. MHSA at FresnoCountyCA.gov. That's the email that you can send any and all questions, comments, anything related to the Mental Health Services Act, our annual update, or any of our community planning. So if over the next few weeks you have a question, an idea pops in your head, anything like that, that's the best way to reach us. You reach us through that email. That way we can keep record of it, as well as making sure that we respond to it. The URL, like I said, for the particular MHSA page on our county site is FresnoMHSA.com. That's just the easiest way that you can get to that page and find it. A lot of information on there. Today is not the only time that people have an opportunity to participate. Like I said, you can post comments or questions in the chat for the next 5 days. We'll monitor. Over the next couple of weeks, you can email us at MHSA, FresnoCountyCA.gov. We are going to be taking the information from emails, questions, chats, some of these forums that we had, start putting it together, and really look at what are some of the community input and look at how we're going to develop the annual update. And then be able to have several report back sessions. We'll come back and give feedback to our stakeholders in terms of what we heard and what we're looking at. And then we'll develop or put out the MHSA annual update that will then have 30 days plus a public hearing. So we'll report back and have conversation with the community before we get to putting the plan and where people have to comment on the plan. So you'll know ahead of time what's in the plan. But as we shared several slides back, in Fresno County, we are not looking at making really much drastic changes to our current MHSA planner annual update. We're looking at what is our capacity with us and our system of care. Partially, we're looking at funding, making sure that there is money available before we put new programs in, we can sustain them. We're not asking for funding. We actually have it. We're trying to make sure that as our stakeholders are asking for programs, that we are able to fund those. And also making sure that we're able to fund those in a way that will be sustainable for years to come. We're also continuing our process of evaluating all programs to look at, are there programs that we could be drawing down additional funding for? Are there programs that we should be funding in a different way or utilizing other funding sources and freeing up some of this MHSA dollars to do other work? Right sizing. So like I said, we're doing a lot of work, and we're hoping that work will provide us with information we need so that as we come around next year to do our new 3-year plan, we'll be able to make a lot more informed decisions in terms of what we're going to put forth at that point. Aaron, are there any questions in the chats yet? Not obviously in this one, but on Facebook or YouTube, not yet. So we are at 12:34. We'll give it a few more minutes. Again, if you come up with a question or thought or idea later, please use the MHSA email. Email us the question, comment, the thought. These again are live streamed, but they're also archived on those platforms. So if you want to go back through this or some of the other previous ones, if you want to see, what we did on, I think it was Tuesday, it should have been the same as this, or the Spanish one or the Hmong one today, you can go back and watch those as well. Because they're archived, you can share them with people. So if you have individuals that you think might be interested or have some input, you can give them the Fresno MHSA website so they can watch the short videos and kind of get a sense for what the MHSA is and what we're doing. You can send them links to these live streams so that they can watch it and see it, and then they can add their questions or comments or submit those to those as well. I think we have a lot of the questions or comments, so we'll give it another minute or two, and then we'll go ahead and wrap this one up. This will be our second one of the day. I think our last one, we did have, I think, 11 or 12 comments, which was really useful. And like we said, we'll hopefully report back in a couple of weeks, and we'll notify individuals through our listserv, through our social media, but as well as the FresnoMHSA.com page of when we'll have what we call the follow-up sessions, the dates and links for those, and long before we put out the plan, and then we'll also have information when the annual update is available for review. All right, we're going to give it another minute. Go ahead and wrap this up. Sure, if people got on there late. Aaron's telling me still no comments. That's fine. If you're watching this later and it's within 5 days of this, you can go ahead and put your comments in the chat. If you're watching it on YouTube or Facebook, the easiest way also is just use again that MHSA at FresnoCountyCA.gov email for any questions or comments or things like that you may need. All right. I know we had this set for 12 to 1. We planned about 20 or so minutes for our presentation, but being the fact that throughout we didn't have a lot of questions or comments, we did try to fill a little more space. But it looks like most people are hopefully satisfied with the current information. Hopefully everyone now knows where they can submit questions or comments, or if they need additional information. And we look to come back to you all here in a few weeks with some additional updates. If there's no more questions or comments at this time, we're going to go ahead and wrap up this live stream as well as our community planning process meeting, our fourth one related to this annual update, and be back in a few weeks with some updates or with our follow-up session and giving you a little bit of information and idea on what to expect or anticipate in the annual update. With that said, we're going to go ahead and stop sharing that. There's no other questions. We're going to go ahead then and wrap up. And again, email us or post in the chat, and we'll be more than happy to answer any questions people may have. Thank you all. Have a great day. And we'll hopefully check back with you guys all soon.